Well, PANS and PANDAS have multiple pieces to them, and you really need to address all of the pieces and treat all of the pieces to try to make the patient whole again. We need to address the OCD and the anxiety and the school issues in the children because sometimes it takes time for the treatments to get the children feeling completely better. From an immune standpoint, we need to try to reduce the number of infections that the children are having and treat the infections aggressively when they get them. So there are many strategies that we use related to that, including the use of antibiotics to treat the infections. The use of anti-inflammatories to reduce the inflammation and try to reduce the symptoms that way is also important. And there are several different steps that we use to try to address the inflammatory effects, reduce the inflammation, and reduce the symptoms of PANS and PANDAS.
Then we want to make sure that we actually address the concerns that the child has and the family has regarding their OCD or whatever their other presenting behaviors and changes are. The treatment of PANS and PANDAS can be challenging because the behavioral characteristics of PANS and PANDAS can take a long time to get better. So for example, if we use a behavioral intervention to treat OCD, that can take several months before children and families start seeing some improvement. And so that can be challenging for everybody. We do try to make sure that we have treated the infection adequately and treat any infections that recur. And then we use anti-inflammatories and immune modulation as needed. In general, our first step for this is to use nonsteroidals, which is just over-the-counter ibuprofen or naproxen, and use those to try to decrease overall inflammation. After that, we will consider, if children don't respond to those interventions, we'll consider oral steroids. We will consider more intense immune modulation if needed. But in general, for many children, we can treat them with just by treating their infection and with nonsteroidals.
So there are basically three different buckets that we pull treatments out of when we're thinking about trying to treat patients with PANS and PANDAS to reduce their inflammation. The first group that we'll pull from are the nonsteroidals, the anti-inflammatory treatments. These include the over-the-counter medications like ibuprofen and naproxen. These are very effective drugs at reducing inflammation and have been shown, especially during acute attacks, to work very well. The next group of medications we'll consider are steroids, which are also very good at reducing inflammation, better than the nonsteroidals, but they have significantly more side effects. And so we tend to be more cautious in using them. The last group of treatments that we'll consider trying are some of the biological treatments, such as high-dose IVIG, which has an anti-inflammatory effect. This medication has been shown in many studies to be beneficial in controlling inflammation and has been shown to reduce the symptoms in PANS and PANDAS patients as well.
So when we're trying to decide what kind of treatment to use, we first look at making sure that we've adequately treated whatever the inciting infection is. With the knowledge that the sooner that we treat, the more likely it is that the child is going to recover completely. So we want to make sure that we treat the infection and treat the inflammation as safely and simply as we can, and usually that is with a nonsteroidal anti-inflammatory medication. After that, we still have to step back and say, is what we're doing working? Are there other strategies with medications that we need to implement? Are there other strategies treating behavior giving support in school, giving support in families are other things that we need to do to help this child recover.
Everything is a risk-benefit assessment when we're trying to decide how to treat children. So we always start with the lowest risk treatments, hoping that they'll work. So we, in general, will start with the nonsteroidals and then move up as the children show us they need more help to maintain medical control of their inflammation. Treatments for PANS and PANDAS really need to be individualized and need to address all the components of the illness that the child has. So the children are the ones that tell us exactly what it is we need to do as far as treatment is considered. In addition to looking at the symptoms, we need to look at the triggers to try to figure out how best to control these. We need to look at the family situation because there are different treatments that are better tolerated in different homes, and we need to make sure that we're approaching this from a family-oriented perspective.
One of the important things to remember is that the sooner we treat, the more likely we are to help a child recover. And the initial treatments that we use are antibiotics in general to make sure we're not missing an infection, and an anti-inflammatory. Both of those are commonly used in the community by all kinds of providers and are fairly low risk. So in general, if you're in the community, you're considering this condition, I would treat with those two to make sure that we address the condition as soon as possible. After that, we have some time to step back and look to see if we should do more intensive treatments.
We treat patients as long as they need to be treated. We try to control the inflammation as best we can with the anti-inflammatories, and we control the infections. The issue is that another infection can always trigger another set of symptoms, and so we need to make sure families are armed and ready to treat these infectious and inflammatory events as they come up. The hope is that with early diagnosis, early treatment, and early intervention, we'll be able to prevent worse disease, which will require longer-term management.